Good afternoon, and welcome to the latest episode of the Beyond the Blueprint webinar series. My name is Greg Malkery. I'm the Managing Director of the Spyglass Consulting Group. I'm also the host of this series. Joining us today is our guest speaker, Kevon Kothari. Kevon is a senior healthcare IT executive with more than 18 years of experience holding various senior roles across the healthcare spectrum at payers, providers, and within the life sciences industry. Kevon, welcome to our webinar. Would you like to share a few opening remarks?
Well, thank you for having me, Greg. I appreciate it. I think you did a pretty good job covering my background. I've been doing this for a little while. I had worked in large corporations, large business units, small business units, built up my own startup for several years and worked across the industry. So I'm looking forward to having this conversation today.
Oh, great. Also joining me today are our sponsors. We have Lars Anderson from Storage Systems. We also have Keith Washington from Simplify Medical. Lars and Keith, could you please introduce yourselves?
Yeah, thanks. This is Lars Anderson with Storage Systems Unlimited. We're a distributor of a number of different storage items, including telehealth carts, partner with our good friends over at Simplify. So looking forward to a nice education here on how things are developing in the telehealth world and where we're headed.
Yeah, so this is Keith Washington, Simplify Medical. We do point of care technology, mostly cart-based, so workstations on wheels and related technologies for tablets, for mobile computing, and really glad to have Kevon here today joining us on Beyond the Blueprint.
Well, within the Beyond the Blueprint webinar series, we delve in strategies and approaches that healthcare organizations might consider when integrating digital tools during a hospital remodel, new construction, or renovation project. Today's webinar is going to focus on the evolution, challenges, and future outlook for healthcare organizations planning to deploy digital engagement tools in order to help enhance the patient experience, boost staff productivity, and reduce the total cost of care. Kevon, maybe we can begin by describing your role that you played within industry in helping shape and define digital engagement strategies.
Well, that's a great question. So I've done a lot of different things ultimately over the last 18 years, from everything from research, ethnographic research, and product market fit research, and to understand the transition from, let's call it, in facility, in hospital care to how do we deliver that same level of quality and service of care outside of the traditional setting. So originally within Intel, did a lot of investing in the space, figuring out the ecosystem, what the players look like, and did eyes and ears investment, helped Intel build out their thesis around patient-centered medical home, as it was called then in the early 2000s, created a startup focused on that transition with GE and Intel funding it, ultimately transitioning that product into the life sciences space as well. I've run everything from finance to product to engineering teams. I've done lobbying efforts and recently had reimbursement codes added for RPM and other active telehealth and telemonitoring capabilities and solutions. We've been doing lobbying efforts since the early 2000s, 2004, 2005, 2006. So that's ultimately my role has been to help drive the ecosystem forward to driving and delivering outcomes-based care regardless of the setting.
Within that domain, what are some of the key challenges you've encountered over your career?
Yeah, it's a good question. A lot of it starts with, let's call it, education. So ultimately, people that are delivering care today, physicians, nurses, PAs, med techs, whoever they may be, have been trained on a specific model of care delivery. And that's typically in a clinical setting, under medical supervision, within a hospital, within a facility. So changing that paradigm has been probably the biggest hurdle. Figuring out a way of creating continuity in workflows and the values of the delivery of that care has been the biggest hurdle. Beyond that, reimbursement landscape, again, driving care outside of the traditional setting is not how reimbursement is done today. So figuring out how to do the right studies, do the right work, provide the right education to the ecosystem, be it state and local governments to federal governments, to allow for the reimbursement of the care that's delivered virtually has been a challenge and is always cited as one of the bigger challenges. I would also argue the education and the workflow of existing clinical capabilities and delivering those virtually has also been a big challenge. And so the last 15 years have been figuring out how to knock down individual barriers one by one. So we did the lobbying efforts for 10 plus years, drove a lot of change in the way that reimbursement happened. And over the last 15 years, creating continuing education programs that allowed clinicians to get trained on remote patient technologies, remote capabilities, building out let's call it education infrastructure to allow clinicians to become comfortable with virtual care, let's call it, care outside of the traditional setting, have helped slowly make technology adoption and virtual care more ubiquitous.
Awesome. Maybe more specifically, can you highlight some of the operational challenges that you've encountered deploying emerging technologies like telehealth, remote monitoring, wearables within either a hospital setting or perhaps to support post-discharge care?
Yeah, so there's again, part of the operational, these organizations aren't structured to do remote patient monitoring. They don't have or about external, anything external to the clinical setting. They don't have cell phone networks. They don't manage inventory. It's a different workflow and utilize a capability. So it's always been a challenge because this is not what they are set up to do. Ultimately not. And so the biggest challenge here in that transition is figuring out how to make this frictionless. And we call it the easy button. How do you make it easy for a physician to prescribe out of clinic care in a way that's frictionless and scalable? So that was a process that took years and years in terms of supply chain, logistics, ordering, fulfillment, EMR integrations, all of the things necessary to make it as easy as possible to be able to, I'm going to call it prescribe outpatient care through technology. It was, again, going barrier by barrier. How do we make it easier to deploy high-speed data? How do we make it easier to train not only a clinician or a care manager on how to manage a population of patients through a computer versus in person? How do you get a patient to want to be able to actually interact with a tablet or some computer in their home that is actually collecting their vital signs? So it's a training process, it's an education process, and then there's an operational piece of it where you have to essentially figure out how to build a workflow both in clinic and out of clinic that makes it frictionless for a patient and a provider to let's call it deploy technology.
Anything specifically about post-discharge care?
So operationally or for?
Yeah, operationally.
Well, so the entire infrastructure of keeping what essentially is a off-the-shelf technology in terms of a tablet and peripherals in a patient's home in a clinically relevant way under a HIPAA data privacy, data security infrastructure is less than simple. It's gotten significantly better over time as the tools have become more advanced. But in 2006, those tools didn't exist. So again, as the markets have reacted to the transition of care, the products, tools, capabilities, and services have also transitioned. High-speed data has become easier to get. Mobile device management has been easier to get. Lockdown kits, manufacturers like Care Innovations or others were able to streamline those operational workflows. So it was literally a tap of the button in the EMR to be able to then bring the operation process into focus to get the kits delivered to a patient, get them on board, and get them actively managing their care in their home.
Kevin, what strategies have proven effective, especially during and post-COVID, to encourage clinical staff, patients, and family members to adopt these emerging technologies?
Oh, what strategy? So I won't necessarily call it a strategy, but we've seen pre-COVID, the biggest thing that we've seen is the shift to outcomes-based, performance-based contracts, outcomes-based payment models, value-based care. Comes under lots of different names and forms, but ultimately being paid for the quality of care delivered versus a fee for service or quantity of care being delivered. Pre-COVID, that's where you saw a lot of the unique opportunities, the unique business models taking shape within the care delivery ecosystem. Payers or providers were much more focused on how do we deliver high quality care at scale. And so the adoption of technology became something that was being experimented with more. And I won't say that it hasn't allowed it to get to scale. I don't believe technology use in value-based care, outcomes-based care, or even any care model has truly become a standard of care. But that is an area where that the provider networks, the providers in general, have been much more focused on experimenting.
Then from a CFO's perspective, how do you justify the investment in these emerging digital engagement solutions?
That's a good question. So ultimately, it's the CFO is not just the accountant in charge of profitability, right? Their job is to balance near-term profit and long-term profit, and the delivery of the outcome as the world shifts, as the United States shifts from fee-for-service to value-based care and outcomes-based care and those types of payment models. A CFO needs to be able to make the right bets and the right investments and the right experiments to make sure that the organization that they are operationally in charge of is making the right investments for growth in the future. And so there are a lot of organizations that have already made that transition to more than 50% of their revenue being generated from some type of performance-based contract or an outcomes-based contract. And you're seeing the ones that are successful in that shift are experimenting with technology to deliver care at scale. And to be careful here, it's to optimize care. So physicians should be seeing the most sick patients in their offices, in the hospital, not the least sick. And today, the way the model works is that if you're on the schedule, you could be super sick or you could be there for your annual wellness visit. And it could be one or the other, or in anything in between. And what utilizing technology does is allow you to triage the most at-risk patients in a more efficient manner.
What about in particular around employers or self-insured employers? Are they in a specific category that's helping drive the investments in ROI?
It's a good question. So I think where there's how do I say it? It's a lack of, I'm not going to call it a lack of sophistication, but employers are utilizing technology in the patient care spectrum, but it's typically not through the delivery of their health benefit. It's typically an EAP program or an employee assistance program, or it's an individualized diabetes management program or some health and wellness program that allows you to get reimbursement through an HSA or to have HSA dollars added to your accounts. So they're experimenting in other ways that are health focused, but not necessarily care focused.
Got it. Okay. Kevin, I know you spoke about this a little bit earlier, but can you discuss in a little more detail the current payer reimbursement landscape and in particular how it supports some of these emerging technologies?
Yeah, so it's a good question. So you mentioned employers. So there's two major areas of focus on the insurance and payer side. It's Medicare Advantage, which is very much let's call it performance or an outcomes-based payment mechanism and structure from the federal government. And then there are large, highly concentrated employers, unions, manufacturing that have a high concentration of employees in one location will typically run either a narrow network or some type of performance-based agreements with the providers or payers within the local region, or payviders or integrated networks or ACOs. We can call them anything you want, but those two areas, those two organizations as payers are the ones that are not necessarily requiring the adoption of technology, but to be able to manage the populations in the highest value of care at the lowest cost, technology is going to be an enabler of doing that. So Medicare Advantage, you're seeing a lot of organizations, the One Medicals of the world, the Humanas of the world as a payer, taking on risk of a population and managing that patient base. They are utilizing tools to triage, to analyze, to do care management and outreach, and they're doing some things that are non-traditional. United, like I've read articles where they're building housing for seniors that are under Medicare Advantage, because having a concentration of seniors in one place makes things easier to take care of them and easier to manage them at a much dramatically lower cost. So these types of agreements, payment agreements, are driving unique business models and unique opportunities to drive costs in ways that haven't necessarily been experimented with before.
Kevin, how does this impact the financial planning and sustainability of these programs?
I think that's a hard question to answer, because honestly, we don't have enough data. We haven't done these programs for 20 years. I think you really need 20 to 30 years of history to be able to give you a solid answer. But I think anecdotally, what you're seeing, especially in Medicare Advantage, there's a reason why Medicare Advantage is expanding at the rate that it's expanding. I think payers have found it to be an incredibly lucrative and profitable area of their business. Spending money on wellness and health and care upfront reduces the long-term costs of managing patients. So I do believe that there's anecdotal evidence that shows that there is value in healthcare versus sick care.
Well, certainly, as you've seen the evolution, there are new CPT codes out now for chronic care management and RPM. Have they figured it out, or are we still in an evolutionary process?
All of those codes are still in their infancy. I think most of them are less than 5 years old. I think they're still working on figuring out exactly what those codes need to look like, and honestly, it will drive adoption of those codes to become more pervasive in the ecosystem. Like, I don't believe those codes are being utilized to the degree they need to be utilized to. And I think there's still a lot of experimenting on figuring out exactly what those codes look like in terms of not only what's included within the codes, but the reimbursement amount of those codes in a fee-for-service world.
What are the longer term financial impacts that you anticipate if these digital engagement tools become more widely deployed or adopted?
It's a good question. And I want to say I don't know, but ultimately what you hope. So, I'm going to step back a little bit. So we keep talking about digital tools, digital engagement. Ultimately, all of the things that we're doing in digital isn't about digital care. It's not about digital health. It's about access. What we're trying to deliver is higher amounts and higher quality of access for patients, and the way that they choose to access their care. Think about banking 20 years ago. Nobody had mobile apps. Nobody had, I haven't stepped into a bank in 5 years. I deposit all my checks online. I don't use cash anymore. I use credit cards for everything. I use apps for banking. I transact and provide other people with money through Venmo or Zelle or Cash App. I haven't stepped into a bank in 5 years. I don't think somebody 20 years ago could have ever said that. So why is it, but I don't call any of those things digital banking. Those are just banking. That's how I bank. It's like, so what the tools that we are utilizing for population health management, for virtual care, for patient-centered medical home, for nurse rounding, whatever it may be, they're just tools to make the process more efficient, to drive better utilization and drive better outcomes and provide better access for individuals that may not have access to care.
Seeing that many organizations are still talking about value-based care, and we are in a transition, how should healthcare organizations start to prepare financially for these upcoming changes over the next 2 to 3 years?
You say 2 to 3 years. I think it's a longer tail than that. We're probably looking at a 10-year transition, maybe even longer. Healthcare is the slowest moving beast of most of any vertical that I've ever operated within, and that's saying something. So let's talk about a 5 to 10-year horizon. So what kind of investments do you need to make now? People say the the transition is moving slowly, but I would argue that it's probably moving at the right pace. There's going to be some early adopters that are going to make some mistakes. Those mistakes will be repeated and corrected over time. And late entry into this game is probably not a bad idea necessarily. You get to see what's worked, what hasn't worked. Every large provider in this country is slightly different, right? And everybody, every population is different. Every region, territory is a little bit different. So you get to see the experimentation that's happening and adopt the best case scenarios or the best opportunities, the things that become standard of care. So part of the slowness is there's not enough people experimenting. So I think what we need to do over the next 3 to 5 years is have more organizations make the small investments to experiment on what would work for their organizations and their territories and their regions, and continue those experimentations and let those things adopt over time more broadly. So I'm of two minds of this, right? I do think the transition is a lot slower than it can be or should be, but I'm also of the mind that you're taking care of people's lives, and changing something dramatically quickly may not be necessarily the right first step.
Maybe you can ideate a little bit based on your experience. How do you envision the future of healthcare delivery with the integration of these emerging technologies? And certainly COVID provided us an excellent opportunity to experiment at scale by necessity.
So I do see care where you are as becoming a much more dramatic capability. I don't like the virtual visit through what we saw in COVID. While virtual visits took off as a percent of total volume of care, and the hockey, it was more than a hockey stick. It was like it was a straight up line of increase in percentage of people that used it. It's still a fairly small percentage of the population that actually utilized virtual care, on whatever you choose to call it. So the number of people that did text messaging through their EMR, that did a actual virtual visit, or did some type of virtual care was still a fairly small fraction of the population. So I do think for a great majority of visits that happen today at a physician's office or even through virtual means can happen virtually as a standard of care, right? I think virtual first primary care is going to be adopted at scale. I think that needs to be adopted. I think that is a natural progression of using digital capabilities to deliver care. Most doctor's visits today they don't need to be done in person. So that's, I think, the first big next step. And then from there, again, the access to care, the types of care, I think virtual or digital provides a significant value in terms of access to care. And that's not just rural health. That's hospitals that may not have a specific capability from, a specific type of mental health capability, or some radiology capability, or some other, just there's a mismatch of resources. And so I think digital can help align the mismatch of resources from different provider networks, different provider systems, different states, different locations. Those are your two next big things. And I think in terms of digital helping to transition and change the way health is delivered today.
Oh, I totally agree with you. Well, one thing that's interesting, we haven't spoken about, especially as it relates to value-based care, is the role that digital engagement tools can be utilized to help improve outcomes, and how we might measure that.
Yeah, and I think the jury is still out on. I'm not disagreeing that it will help improve, right? So targeted advertising, targeted campaigning, that has existed for years and years and years, 60, 70, 80 years. The digital targeting's been around for 20 plus years. So that type of outreach and engagement is proven successful across every industry that it's been adopted in. It's not going to change. It's not going to be any different in healthcare. The question is how do you do it in a way that's compliant, HIPAA compliant, data privacy compliant, patient privacy compliant, and how do you do it so you can get to a patient at a teachable moment? They're most affected at moments where they have a problem, have a unique situation, have a specific contextual reason to contextualize what's happening to them, or some. So that teachable moment's really important. Being able to have the care in context, that outreach in context, that targeting in context is really important. And so how do you do that in a way that's repeatable?
Excellent. Hey, Kevin, I'd like to thank you for sharing your insights today. Our discussion today aligns closely with a report that Spyglass published earlier this year, focused on digital patient engagement. Our report uncovers some of the market trends driving investments in usage models. It identifies the opportunities and challenges for supporting large-scale deployments, and suggests how healthcare organizations can leverage digital tools to prepare for future healthcare delivery models. Within the report, we also explore how the pandemic served as a tipping point for healthcare organizations to accelerate digital strategies by supporting the transition to hybrid care models and identifying opportunities for clinical and technological innovation. To learn more about my report, I encourage you to go to my website at www.spyglass-consulting.com. Well, I'd like to thank everyone for joining today's webinar, where we discuss the evolution, challenges, and future outlook for healthcare organizations considering the deployment of digital engagement tools. Before I wrap up, though, I have a couple of polling questions.
Mhm.
And if you could respond in the comments section below. And if you could rank them based on the following, a scale of 1 to 5, with 5 being the 100% agreeable. The first question is your organization making patient safety a top priority? And the second question, if you could also respond in the comment section, is has your organization made wise investments as it relates to remote patient monitoring technology? Well, I'd like to thank our guest speaker, Kevon Kothari, for his time and insights. Kevin, do you have any closing remarks that you'd like to make that might sum up some of the key themes you've discussed during our 25 minutes together?
No, so again, the transition of care is happening. Digital is going to be a driver of the way care is adopted going forward. We're in a really, really interesting time in healthcare. The adoption of technology to make care, the outcomes and the delivery of that care better is, I mean, exciting. And it's why I enjoy being in the healthcare industry. I enjoy the technology aspects of healthcare. And I think this is a fantastic time to be in healthcare and be working on technologies and tools and capabilities to help clinicians deliver better care.
Awesome. Thank you, Kevin. I'd also like to thank our sponsors, Storage Systems and Simplify Medical. Lars and Keith, do you have any final thoughts you'd like to share with our audience?
Yeah, I thought that was very informative, and you really hit on the value of thinking ahead and having the right tools in place, and being more proactive than reactive. And that's where we like to get involved early on in the planning process when someone is looking at a renovation or a new build. So really appreciate the insight, Kevin.
Yeah, this is Keith Washington with Simplify Medical. So I really appreciate Kevin's perspective. Actually, very helpful in terms of how we think about the physical space in beyond the blueprint from a facility layout perspective, and then how the digital tools are transforming a lot of these care settings and making a lot of progress. It's exciting to hear, and really appreciate Kevin's enthusiasm and passion around this topic.
I appreciate it.
Well, thank you again, and we look forward to continuing the conversation during our next scheduled episode of Beyond the Blueprint. Kevin, don't get too comfortable. We are going to come back to you in 6 months.
Sounds great. I look forward to it.
All right, take care, guys.
Great day.